All right.
Hello, Christine.
Hello, and
Do you
hi
have a
everyone.
do you have a microphone on with you today?
Why? Does it look like I
It
have one?
does. Maybe it was just a hair. Maybe it
Oh,
looked like you had a very special, sleek
no.
microphone going up to you.
No, it's the microphone look. I went to the salon
Yeah,
and
that's
all
good.
the rage.
That's all the kids are doing it nowadays.
Yeah.
Nice.
Yeah.
What are we talking about today?
Endocrine system. So this is endocrine glands. They secrete the hormones that go directly into the bloodstream. So you might remember from earlier lectures that these are ductless. And there are a number of glands and organ systems that do secrete hormones directly into the blood, although not all of them do. But for this lecture, the hormones are in the blood. And what that means is that they can travel around the body and they're able to initiate a lot of different body functions like growth, development, metabolism, fluid and electrolyte balance, and immune and inflammatory responses. And so for the exam, you're going to need to know the names of the glands and the functions that they affect. There is a table, table 12-1 on page 265 of your textbook, and it has the glands and the hormones and the functions, and it's a really easy to understand table. So you should definitely take a look at that and use that for studying. So hormones are secreted by other organ systems, like the kidney that produces the erythropoietin. And that's what we talked about in past lectures. So we're not going to be talking about those kinds. So we're talking about the ones specifically that are directly secreted into the bloodstream. So the other thing about hormones is they're secreted as needed. So when there's like a blood level of a hormone, and if that becomes low, then the gland that is responsible for secreting that hormone secretes more of it. And then when it gets to the appropriate level, it stops. And then when the blood level gets too high, it'll, do the opposite. So when the blood level of the hormone is too low, that's called hyposecretion, and too high is hypersecretion. So you do need to know the effects of hyposecretion and hypersecretion from each of the endocrine glands that we're going to talk about.
Endocrine system is so fascinating to me, and it can be really hard to understand and learn. But it's just a big system of checks and balances. This specialized, group of cells measures this chemical, and if it's high or low, it's going to tell the endocrine system to either secrete more or secrete less of this hormone that'll have these other effects to it. So it's just the checks and balance system of the endocrine system is really fascinating to me, but can be overwhelming. So I think that table 12-1 on page 265, that really just makes it simple and puts it all in one area that we can learn it from. But I think it is pretty fascinating.
Yeah, that's a good way to look at it with the checks and balances. I was trying to think of like imagining, it's like a hormone, all these different hormone bank accounts, and your account's low, or, well, I guess their accounts don't get too high. Well, mine don't, but
mine never get low.
Oh, great. All right.
All right. Endocrine gland functions. Well, they produce hormones, store hormones, secrete hormones. Endocrine will secrete directly into the blood system. They are ductless glands. They differ from exocrine glands because exocrine does have those ducts to it. So just a little difference of that. The effect of endocrine gland activity, we can grow and develop. We'll look at some in a little bit. Metabolic functions such as digestion, elimination, breathing, blood circulation, body temperature, they can all be affected. Sexual function, mental ability, and different emotions. ranging from PMS to bipolar disorder, ability to concentrate. So all of those, really anything with the emotional aspect of the person can be traced back to the endocrine system.
And
Some different problems that could arise. Congenital, what does that mean, Christine? Congenital
genital
anomalies.
means you're born with it.
So baby, we're born with it. Ischemia.
Maybe it's congenital.
So ischemia, decreased blood supply, some sort of trauma or surgery, infection, inflammation, immunity, cancer, and with age, things change as well.
So then we have our entire endocrine system. So there are endocrine glands all over the body. And so we have the pituitary gland. So that this is controlled by the hypothalamus, and that's located above the midbrain. And so the pituitary sits anterior to the hypothalamus, and it controls the function of a lot of the different endocrine glands. So that means that when there's an abnormal level of a particular hormone, it could be due to a problem with the gland that produced it, or it could be a problem with the pituitary that's actually telling it to produce the hormone. So that's why the pituitary is sometimes called the master gland. And then we have the thyroid gland and the parathyroid gland, and those both sit in the throat. The ovaries are in the abdomen in women. The testes are in the gonads in men. The pancreas contains the islets of Langerhans, and that maintain the blood glucose levels. And then we have the adrenal glands, and those are located just above each kidney. So we are going to talk about the hormones that are produced and secreted by each of the glands, and the effects of the over or under production of the secretion. So for the pituitary gland, it has two lobes. There's the adenohypophysis, or the anterior pituitary, and the neurohypophysis, or the posterior pituitary. And so those are located at the end of a stalk, and it connects the pituitary to the hypothalamus. And then the hypothalamus regulates the anterior and the posterior pituitary, and that's through circulating releasing factors, and they stimulate the production of hormones. And then we have the anterior pituitary, so that produces the 6 tropic hormones. So for these, we have the somatotropin, or growth hormone, or GH, and that's more active when a child's growing. It's responsible for the increasing size of bones and the organ systems and the development of the certain organ systems. And then after puberty, it's responsible for the repair process. Then we have thyroid stimulating hormone, or TSH, and that stimulates the thyroid gland, and it's responsible for metabolism and energy expenditure. And then we have the adrenocorticotropic hormone, or ACTH, and that stimulates production of hormones in the adrenal gland. The gonadotropins are responsible for sexual function and development, and there are 2 hormones, 2 of these, and it's follicle stimulating hormone, or FSH, and then luteinizing hormone, or LH. So the follicle stimulating hormone is what stimulates the production of the eggs and sperms, and then the luteinizing hormone stimulates the ovaries to produce the estrogen and progesterone, and testes produce testosterone.
Gonadotropins is a fun word to say.
Yeah, I would say all these are really fun words to say.
Yeah.
I'm really enjoying myself.
Good.
And then we have prolactin, and that stimulates breast development and also milk production. So lactin and milk production is like, sounds like it would be related to milk.
Posterior pituitary secretes the antidiuretic hormone, ADH, also called vasopressin, and it also produces oxytocin. Diuretics cause urination, so antidiuretics will cause fluid retention as the kidneys absorb the water instead of passing it. Oxytocin stimulates uterine contraction, release of milk, and prostate secretion. I read a story, new police blotter one day of somebody broke into a veterinary clinic to try to steal Oxycontin, and they actually stole oxytocin, and they did not have the effect that they wanted.
Mm,
But
yeah.
disease of the pituitary, we said this at the beginning, when you have too much, when you have too little. So hypopituitarism, so too little, hyper, too much, and then diabetes we're also going to talk about in the posterior pituitary.
So hypopituitarism. So there are a lot of different effects that can result from pituitary hyposecretion, and that depends on the location and extent of the destruction or the dysfunction. So one condition that can be caused by anterior pituitary hyposecretion is pituitary dwarfism. And there are several different types of dwarfism. So in this type, there's slow growth, and it is noticeable before age 5. The body, the head, the arms, and the legs are all proportional. And this trait varies with different types, but there are also other effects from the absence of the tropic hormones. And that's what we're going to be talking about a little bit later in the lecture. But this type of dwarfism has absent or delayed sexual development, and it can be treated with growth hormone replacement therapy. So the person will always be smaller, but closer to a normal range for height and stature with hormone replacement therapy. And so if you think about, for the glands to function normally, they need to have there has to be, your body has to have the right amount of the hormone. And we're able to supplement with these hormones to balance things out when they are too low.
Pituitary dwarfism different than the genetic dwarfism that we talked about a handful of weeks ago. And I actually have one of my wrestlers in my youth program. He is 8, and he's one of the smallest people on the team, but he is on human growth hormone. Bangs out pull-ups like you would read about. Just boom, 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 boom.
Mm-hmm.
But yeah, that's the one instance I can remember. I don't know of too many others cases of that.
Yeah, I have not come across it. And then we have the absence of the tropic hormones. So the effects of the hyposecretion of the tropic hormones, there are several, and it depends on the extent of damage to the gland. And any or all of the tropic hormones can be deficient. So this can result from, if there's a tumor or radiation treatments, if there's trauma, like a fracture of the skull, it could be because of genetics, and it can be idiopathic. So that means,
I don't know what that means. Probably some sort of genetic, environmental components to it.
Yeah. So if the thyroid stimulating hormone is affected, there can be a decreased thyroid function and possibly atrophy of the thyroid gland. And so that ends up presenting itself with drowsiness, lethargy, and mental dullness. And then a lack of adrenocorticotropic hormone that can result in a fluid and electrolyte imbalance, and also improper metabolism of nutrients. And then absence of the gonadotropic hormones can result in gonadal atrophy and sexual dysfunction. And then again, we talked about lack of growth hormone that can result in dwarfism.
I always think, so the thyroid energy is what I always think of, either high or low energy. Adreno is kidney. So what is the function of the kidney is all fluid regulation, both electrolytes and just the amount of fluid. And then gonad, sexual performance and function. So if you can remember the roots of those words, then what the problems are kind of start making sense.
Yeah, that's good.
Hyperpituitarism. So the result of overproduction of the growth hormone, usually due to a tumor, causing the hyperstimulation of the gland. Removing the tumor or shrinking it can decrease that stimulation. Before puberty, the condition is referred to as gigantism. Sexual development is decreased, maybe some mental retardation, delayed closure of growth plates, causing increase in height and size. If hypersecretion starts after puberty, it will result in acromegaly, which the individual will have obtained their full height, but the bones in hands and face will enlarge, and the soft tissues will enlarge in the face as well. There's an overgrowth of the jaw, so there might not be good dental alignment. Chewing may be involved. If there's an overgrowth of the tongue, it can be cause speech involvement, and overgrowth of the vertebrae can result in curvature of the spine. Who was that motivational speaker we were talking about earlier? Tim Robbins? Tony Robbins? Tony Robbins. Tony Robbins, I believe, has acromegaly.
Okay. Did you hear that, or you just are guessing?
I heard it when I said it. I'm pretty sure. I think he, and then there's a couple of professional wrestlers. Andre the Giant is one with gigantism, if you can remember who Andre the Giant is. But yeah, I'm 90% sure. While you do the next slide about diabetes, I'll look up all about Tony Robbins that you want.
No, you don't need to.
Well, it's too late now, Christine.
All right. So diabetes insipidus, not to be confused with diabetes mellitus. So diabetes insipidus is caused by a lack of the pituitary hormone, the antidiuretic hormone, or ADH, that stimulates the adrenal gland, and diabetes mellitus is caused by a lack of the production of insulin in the pancreas. So in the picture on the slide on the left, you can see the normal function of the antidiuretic hormone that allows the water to be reabsorbed and electrolytes like the sodium to be excreted. And then in the picture on the right, you can see that the water is being excreted and the electrolytes, such as sodium, are being absorbed. So this results in polyuria, or increased urine production. So polydipsia, or increased thirst, can be the result of that as well. And that can also cause urinary frequency, and that can lead to a loss of sleep or to bedwetting. So its causes are the same as the anterior pituitary. The treatment is aimed at resolution of the causes and the prevention of dehydration. And then vasopressin can be administered. There is a nephrogenic form of diabetes insipidus, and that's not going to be on your exam, but it is a problem with reabsorption in the tubules of the nephron and doesn't respond to vasopressin. So just so you know, in practice, that there is that type that doesn't respond, but it's good to know that there are the two types. All right, Josh, you're up.
Tony Robbins had a tumor on his pituitary gland that caused him to grow 10 inches in 1 year when he was a teenager. The tumor disappeared on its own, but still he has an overproduction of growth hormone.
Wow, I would love to be able to interview someone who went through something like that.
Well, you might also be able to interview Andre the Giant, Paul Benedict, Paul Wright, Ted Cassidy, Sultan Kosin is what Wikipedia is telling me. So yeah, there's a handful of other people. So there you go.
Interesting.
Other things. So next up, thyroid gland. So there's a step-by-step process in place in order to have a normal thyroid function. The picture on the left here, the hypothalamus sends releasing factors to the anterior pituitary gland to release the thyroid stimulating hormone. The thyroid stimulating hormone goes into the thyroid and releases thyroxine, which is secreted into the blood. Now, your book mentions two thyroid hormones, thyroxine and I'm sorry, you're gonna have to help me with this one. Triiodothyroid, was that one?
iodothyronine.
All right, that sounds good.
All right.
So I don't feel that we need to get as specific. So just remember, their primary hormone secreted in the thyroid gland is the thyroxine. When the blood passes into the hypothalamus determines if the thyroxine level is high or low. And then this is going to, again, that checks and balances system is going to start the process over. If it's normal, it doesn't send the releasing factors to it. So table 12.2 in your textbook provides an area describing the areas of the body affected by the thyroid function. So the losing of the thyroid function can be very debilitating because of how many different things it can affect. The thyroid regulates metabolic rate, metabolism of nutrients, oxygen consumption, controls temperature regulation, stimulates the GI system, secretion of digestive juices, promotes normal heart, nervous system, musculoskeletal. So it really branches out into just about every single aspect of the body that we could see. So the thyroid, when it's hyposecreting, low energy, hypersecretion, high energy. So that's why I said earlier, I just think of the thyroid as energy levels, high or low.
Mm-hmm. Yeah, that makes sense.
Disease of the thyroid, goiter, hyperthyroidism, and Graves' disease, hypothyroidism, and you'll have to step in to pronounce some of these words for me, Christine.
All right.
So a goiter is just an enlargement of the thyroid gland. Could be due to hyposecretion or hypersecretion of the thyroid gland. It's another symptom of the hyper or hypothyroidism. More prevalent in women over 40. Hyposecretion of the thyroid is caused by inability to produce thyroxine or insufficient iodine in the diet. This can result from eating foods that decrease thyroid hormone production, such as soy, peanuts, peaches. I didn't know peaches. That was spinach, turnip, cabbage, Brussels sprouts, and seaweed.
Mm-hmm.
Immunosuppressant medication and lithium can also affect thyroid function. Hypersecretion of the thyroid, there are excess secretion of the thyroid stimulating hormone by the pituitary due to a tumor or nodules or inability of the body to synthesize thyroxine, allowing it to build up. So the goiter can grow large and put pressure on the esophagus or trachea. Could be treated with iodides, thyroid hormone replacement therapy, diet, radiation to shrink it, or maybe surgery to remove the thyroid, after which hormone therapy would be needed. Hyperthyroidism caused by adenoma or an autoimmune disorder where the thyroid produces excess thyroxine. Graves' disease is the most common form with it. It's more common in women, onset between 20 and 40 years old. With hyperthyroidism, the goiter is often present. Signs and symptoms are in high gear. So they are increased nervousness, increased irritability, high metabolism, very thin, weight loss and diarrhea, again, because of the effect of the GI system, rapid irregular pulse, tremors, sweating, and a bulging of the eyes is when I think of Graves' disease, I think of the bulging of the eyes as the number one thing that I can think of.
Mm-hmm.
So very thin, high energy, high alert with really bulging eyes. Hyperthyroidism can be treated with medications to inhibit the production of thyroxine and hope that the levels will reduce to normal. If it can't be restored, then radiation or surgical removal of the thyroid might be needed, and then medications after the fact.
You want me to grab the next one?
Sure. Here's that picture of the bulging eyes for us.
So that's exophthalmos. So that again is the sign of Graves' disease.
Yep. It's also after I took my family to Disney, after I saw the bill. Oh my goodness. Same effect.
That took me a second. Yeah. Okay. And then we have acquired hypothyroidism. So hypothyroidism is caused by inadequate levels of thyroxine, and that can result from poor pituitary production or secretion of a thyroid stimulating hormone. And it's inadequate medications to control hypothyroidism, especially after removal of the thyroid and radiation to the thyroid. So the acquired form is called, oh, is this the one where you were wondering how to pronounce it?
Myxedemia.
Yeah, my myxedemia. So it affects middle-aged women more than men. So signs and symptoms of this one, of acquired hypothyroidism, are low gear. So there can be bloating, including a thick tongue and puffy eyelids. So bloating, like even in the tongue and the eyelids, dry skin without perspiration, weakness, slow reflexes, fatigue, weight gain, slurred speech, slower speech, memory problems, infertility, depression, and then a goiter may also be present. And then treatment is thyroxine or thyroid hormone, and that's taken for the remainder of the person's life. And then we have congenital hypothyroidism. So this is known as cretinism, and it's caused by a lack of development of the thyroid. And it can be caused by iodine deficiency in the mother. So there can be developmental delay, as well as other signs and symptoms like dwarfism and characteristics like broad nose, small wide set eyes, puffy eyelids, protruding tongue, short forehead, and underdeveloped genitals. And then treatment is with thyroxine, and the sooner it's started, the better. But there can be fewer symptoms, and some, like intellectual development, can improve with early intervention.
There are 4 tiny parathyroid glands located in the posterior aspect of the thyroid. So in this picture, here's the posterior aspect. You can see in the green depiction of the parathyroid glands. So they're nestled within the thyroid. It secretes the hormone parathormone, or the parathyroid hormone. Parathyroid glands regulate blood levels of calcium and phosphates, which is important for clotting, skeletal muscle contraction, heart muscle contraction, bone cell formation. Parathormone causes kidneys to absorb calcium, so it's not excreted, and the small intestines to absorb calcium back into the diet. So when the calcium level is low, the parathormone is released to increase the absorption of calcium into the digestive system, and the kidneys to restore the needed levels. So again, hyper too much, hypo too little. Hyper results from the excessive secretion of parathormone. The condition is more prevalent in postmenopausal women over the age of 50. People that receive radiation in the neck, people who take medication lithium are at risk factors for hyperparathyroidism. Excessive secretion of parathormone increases blood levels of the calcium, which is called hypercalcemia. Increase in calcium in the blood where there's less in the bones, causing them to bow or break. Giant cell tumors and cysts may also form in the bones. Excess calcium can also cause kidney stones to form. It can build up on arteries and organs such as stomach and lungs, causing the decreased compliance in arteriosclerosis. And it causes muscle weakness in skeletal muscles and slows the heart rate. There could also be some GI disturbances. Hypoparathyroidism, decrease of the parathormone. It's caused by damage to the glands or exposures to toxins, immune disorders, infection, and could run in families. Also could be removal of the thyroid, could cause it as well. Results in hypocalcemia, which is the calcium is not absorbed by the kidneys and small intestines. The absence of calcium causes hyperexcitability of the nerves, which can result in sustained contractions or tetanus. usually in hands and feet. Most often is treated with calcium and vitamin D supplements. Most of the effects are temporary, but chronic hypoparathyroidism is rare, but can cause personality changes, tremors, and visual problems.
Okay, and then we have hormones of the adrenal gland. So the adrenal glands sit on top of the kidneys, and the glands have an outer cortex and an inner medulla, and they each secrete different hormones. So the cortex is stimulated by adrenocorticotropic hormone, and that's ACTH, and that stimulates the production of mineralocorticoids, glucocorticoids, and sex hormones. So the mineralocorticoid, aldosterone, causes the kidneys to retain salt and to secrete potassium. And then the glucocorticoid, cortisol or hydrocortisone, is what regulates the metabolism of carbs, fats, and proteins from the diet. And then the sex hormones include the male hormone, androgens, and the female hormone, estrogen. And then we have the medulla that secretes epinephrine and norepinephrine. And we learned previously when we talked about EpiPens, epinephrine causes vasodilation and increases the heart rate, blood pressure, and respiration. And then norepinephrine causes vasoconstriction. So they work together and they direct the blood where it's needed. And they also come into play in stressful situations with the fight or flight reaction. And then we have the diseases of the adrenal glands. So we have Cushing's syndrome, and that's due to an overproduction of the glucocorticoid hormones or of cortisol. And that's caused by a tumor, usually a benign pituitary tumor or an adrenal tumor. So it can also be caused by prolonged use of cortisone, and it raises the blood sugar so that there's another type of diabetes, adrenal diabetes. There's also hyperlipidemia, and that causes atherosclerosis, and there's high blood pressure with fluid retention. And as with other forms of diabetes, these individuals are poor healers. And people with Cushing's syndrome also have weakness. Their bones fracture really easily. They gain weight and retain fluid, especially in the abdomen. And the characteristic appearance is described as having a round body, a moon face, and a buffalo hump, or accumulation of fat that's behind the shoulders. And then treatment focuses on decreasing the production of glucocorticoid hormones by removing the tumor in the adrenal or the pituitary glands. And then there's also medication that blocks the production of cortisol, the glucocorticoid hormone. And then we have Conn's syndrome. So this is excess secretion of aldosterone, and that can be caused by a benign adrenal tumor. So this causes a retention of sodium and water and causes high blood pressure and increased excretion of potassium, and that causes muscle weakness, muscle cramping, fatigue, polyuria, and polydipsia. It is more prevalent in women. Individuals with Conn's syndrome are at higher risk for heart attack, stroke, and kidney failure, and that's because of high blood pressure. And then the treatment includes medication to decrease blood pressure and an aldosterone blocker, and then sometimes surgery to remove the tumor, and that usually leads to a good prognosis.
Addison's disease, atrophy of the adrenal gland due to steroid abuse or an autoimmune disorder, so caused by hyposecretion of the adrenal hormones. It is rare, but affects women more than men. Lack of cortisol, aldosterone, and androgens. This causes an inability to retain salts and water, leading to dehydration, low blood pressure, syncope, or fainting. GI disturbances like cramping and diarrhea lead to more weight loss and fatigue and weakness. Increased pigmentation in the non-sun exposed area. And there is danger for people with Addison's disease to develop other conditions such as infection or trauma. These can increase Addison's symptoms, causing major dehydration and lead to shock and death. IV rehydration needs to begin immediately. So that's something we're going to be wanting to educate our patients on and then be aware of, especially if we're performing exercise understanding that they can become dehydrated very quickly.
Mm.
Hormone replacement therapy, which will need to be constantly monitored, especially in times of stress.
So then we have the pancreas, and that sits below the stomach. On one end, it secretes digestive enzymes through the pancreatic duct into the small intestine. And on the other end, from an area called the islets of Langerhans, it secretes insulin from beta cells, glucagon from alpha cells, and somatostatin from delta cells. And insulin and glucagon work together to maintain a normal blood sugar level. Glucagon increases blood sugar and insulin decreases the blood sugar. Somatostatin blocks the release of both the insulin and the glucagon. So after a meal, the blood glucose level increases and insulin are needed. And then after sleeping or after exercising, the blood glucose level decreases and glucagon is needed.
Diabetes mellitus, something that this is probably, I think the thyroid is important to understand because we're going to see our patients with high and low thyroid levels. Diabetes has to be the number one thing that we're going to see. And as far as all of the diseases and disorders we've discussed, this has got to be the number one with a bullet on things that we're going to see with our patients.
And one thing at least in my practice, it's often not what I'm treating. It's often a comorbidity, and I have to be very aware of it, which can sometimes be challenging because it's not necessarily the main focus, but you always have to keep in mind that this person has this diagnosis because it can lead to some major issues.
Absolutely. We're going to talk about safety when we exercise in just a few minutes, but this is something that we should be, if we come across it in past medical history, it goes a big star, big capital letters. Next clinician, make sure you understand this, because with exercise and diabetes, it can become life-threatening very quickly. So diabetes mellitus is endocrine disease of the pancreas and interfering with the glucose regulation, causing hyperglycemia. Two different types of diabetes mellitus, type 1 and type 2. Type 1 is juvenile onset, a little bit more serious than type 2. It is genetic, caused by autoimmune process that destroys beta cells, results in little or no insulin production, requiring individuals needed to take insulin for life. They're said to be insulin dependent, might be another way that you see it documented in our charts. Or IDDM, insulin dependent diabetes mellitus. I coached one wrestler who had type 1 diabetes, and it was a constant learning process for both of us. How do you participate in such a high demand sport and also maintain your blood sugars throughout practice and competition? So
yeah, I saw that when I was racing Ironman. I had one of my friends that I trained and raced with a lot. She had type 1 diabetes, and she actually has completed something like 18 full length Ironman events. And it takes her like 17 hours and she gets through it, but she always has those like sugar gels with her
constantly.
Even when she's not training and racing.
Yeah.
She's also a physical therapist. And I really think that understanding has been part of why she's able to do so much.
How many has she done? How many triathlons? Or
At
Ironman?
least 17 of the full distance. So that's 2.4 mile swim, 112-mile bike, and then a marathon. And it can take up to 17 hours.
You said 17 events that she's done of those?
Yep.
That's 18 too many for me. Yikes.
Yeah. Yeah.
Type 2 diabetes is adult onset, insufficient insulin production, generally accompanied by obesity, can be inherited or gestational. My wife had gestational diabetes for both of her pregnancies. Increased requirement for insulin with pregnancy or obesity, causing the increase in blood sugar when the sufficient amount of insulin is not produced. Type 2 diabetes is possible to control with either blood sugar so with diet or with oral medications, also referred to as non-insulin dependent, NIDDM. Oftentimes losing weight, exercise, or just simply give birth, and then you'll get rid of the gestational diabetes, can minimize that. So signs and symptoms of diabetes is with the increase of blood sugar, kidneys excrete more water, causing polyuria, which leads to greater need to rehydrate, resulting in polydipsia. In type 1 diabetes, there's also polyphagia, which is increased hunger. However, this is a problem because typically if we lose weight, we would get rid of or at least reduce the severity of diabetes. But one of the symptoms is increase in hunger. So that's really, really tough for our patients. So important that they need to snack healthy snacks that are low in carbohydrates so we don't get a constant spike in sugars and then a constant drop or a sharp drop. Excess blood glucose will also cause the kidneys to secrete more glucose, leading in glycosuria, which is one of the common tests for diabetes. Also, an inability to metabolize carbohydrates, not just sugar. So you constantly have to weigh carbs versus proteins in your diet. So inability to process carbohydrates could result in the body metabolizing fats, which would result in the production of ketone bodies, which lead to acidosis. This will cause the breath to be a fruity smell in a person with diabetes.
So complications of diabetes mellitus, these aren't signs and symptoms, but are conditions that develop as a result of diabetes. So there's atherosclerosis, and that develops from the hyperlipidemia that causes the plaque to accumulate in the blood vessels, and that leads to poor circulation, and that's where we get poor healing. And then the delay in healing time, that increases opportunity for infection and gangrene, and that can result in amputation, especially in the lower extremities. And this is a lot of the time where I'm treating someone who has diabetes mellitus, is that maybe they recently had an amputation or they have a wound. And that's when they're most directly that in my practice. And then this also can cause high blood pressure, and that can lead to increased risk of heart diseases, retinal blindness, kidney failure, and neuropathy. So we are going to discuss insulin shock and diabetic coma due to hyperglycemia. Those will be separate, but these can lead to coma and death if not treated appropriately. And then for the complications, there's a picture in this slide, and that depicts the complications of diabetes. And then we have treatment. So treating diabetes mellitus, it centers around maintaining a normal blood glucose level. So that's whether you have type 1 or type 2. And individuals with diabetes mellitus have to measure their blood glucose levels daily, and that's using a glucometer. So remember that the blood glucose level can change after eating and during times of physical and emotional stress. Exercise and other physical stresses like trauma or illness, pregnancy, weight gain, they can all alter the blood glucose level. And so sometimes that means that the amount of insulin or medication has to be altered to maintain the appropriate level. So to minimize the amount of medication needed, diet is really impactful. So a diet low in carbohydrates, and exercise is also necessary. So if the person changes the type of exercise, they may need to increase or decrease their medication. And if they stray from their diet, they may need to change their medication. So the goal is to minimize the amount of medication, especially insulin, because when you take it for a long time, the body ends up not producing it altogether. And then smoking promotes the vasoconstriction and causes other things too. So when circulation is compromised, blood pressure is high, smoking only makes things worse. And because the circulation is the most challenged and often the most compromised in the lower extremities, foot care is very important. So inspecting the feet for any open areas and treating them immediately. And so teaching people how to do skin inspections is something that occupational therapists or occupational therapy assistants might do, patient education on. And then that's to avoid infection and ultimately to avoid amputation. And then even the smallest opening, from like cutting nails too short. So a lot of places where you may work, that it may be that the nurses are allowed to cut fingernails, but not toenails and things like that. And this is part of why. So then improper fitting shoes can be a problem. Stepping on a sharp object that can lead to infection, gangrene, and then amputation because of a lack of circulation and delayed healing time. So treating diabetes effectively requires a lifestyle change, like so many other things that we've talked about in this course. So anyone who has had a tendency to gain weight knows that it can be difficult to stay with healthy foods. Smoking cessation is also really difficult. And it's important to remember that it's easy for non-smokers to say, just stop, but it's can be a lot of work for people. So compliance with taking medications, maintaining a healthy diet, exercising, not smoking, taking precautions to avoid infection, optimizing circulation. These are all extremely important and extremely difficult at the same time. So as healthcare practitioners, it's important for us to strongly encourage compliance, but just to be sensitive that the person can be struggling to be healthy. So really looking at helping them to motivate. And then a day of non-compliance is not really the problem for them. It's like getting back on track so that non-compliance isn't what their entire lifestyle is.
Yeah, make the next right decision.
Yeah.
And as far as smoking goes, having somebody change lifestyles is one of the most difficult things. It's got to come from internal. It can't be provided external. And I know in one of my classes, we talk about the 5 stages of what change can take place: pre-contemplation, contemplation, plan, execution, and maintenance. There's a few other models that we talk about, but it is extremely hard. And quitting smoking, I think I read that it takes the average person 7 attempts of quitting smoking before it sticks. So yeah, it's a grind. But one of the other things about diabetes and the poor circulation that I see in the home care setting a lot, poor circulation, especially the distal extremities, especially feet, they sit in front of a space heater, decreased sensation. So the space heater creates a burn, or maybe they accidentally touch the space heater, creating a burn. They don't feel it, leads to infection, leads to amputation because it can't heal. So it's just such a cascade of events that happens a lot. And quite honestly, when a patient gets amputation, typically it's okay. The toe wound isn't healing. We'll amputate the toe. You can basically set your calendar to when they're going to need the next amputation. Once you get that first one,
I've seen that a lot too.
I've been lucky enough to work with people over a decade of their life, when they had all of their toes, and then all of a sudden they had one less toe, and then all of a sudden they had a midfoot amputation, then below the ankle, and then mid tibial or below the knee, then all of a sudden above the knee, and it just creeps up and up and up on them. So if we can help prevent that in any way, shape, or form, that's really important. Diabetic reactions, either too much or too little. So too much insulin or not enough insulin. Very important for us because we will be exercising with our patients with them. So we will come across both of these at some point in our career. So diabetic coma reaction when the person does not have enough insulin. Or they're hyperglycemic, so too much sugar. So signs include fruity breath smell from the ketones in the blood, also labored breathing, lack of perspiration, so dry skin, person will appear lethargic and could go into a coma and possibly die. Important that these individuals take medication. Sometimes when people eat too many of the wrong foods or change their activity level and are less active, their medications could be adjusted. Insulin shock results in having too much insulin or having too much exercise for the amount of insulin that they are taking. So slow, shallow, rapid breathing, normal breath odor, but will perspire or feel clammy. Might complain of dizziness, appear clumsy or stumble, could be mistaken for intoxication. These people need sugar, so they need a glass of juice. I have glucose tablets that I use for that one wrestler. He and I both had glucose tablets on us at all times. And coma can result from this if it's not treated. If the person's not conscious, they need to be treated intravenously. So we need to call 911. So this is a big reason, this insulin shock is a big reason why if we are going to work with our patients who have diabetes, we need to make sure we have fast acting glucose near us. Sugary snacks, orange juice, glucose tablets that, it's just little kind of chalky tablets that you get to chew on that can bring up the sugar right away. I've had one patient I can remember in particular. She was towards the end of her knee replacement rehab at the point where we were doing hard stuff. She would come in and she'd get a workout and break a sweat for an hour. And she was always on top of her sugars until the one day she wasn't. It was just a busy day and she didn't take enough sugar beforehand. And I can liken it to it looked like she was having a stroke in front of me. She had lots of sweating, confusing, and she at one point I just knelt next to her and I said, "What's going on?" She goes, "You need to call my daughter." Okay. She said the daughter's phone number. And then I said, "Can you repeat that?" And when I asked her to repeat it, she couldn't come up with the right number anymore. Like that was it. And luckily we got the right number. And luckily we recognized she was a diabetic and gave her sugar right away. And as fast as she was going down, she came back right away. Within 10 minutes, she was back to normal. So it was pretty fascinating to see. But always, 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 one, educate our patients on proper foot care, like you had talked about. Staying away from space heaters is a big one in the home care world. And then if we're going to do exercise with patients with diabetes, we have to have fast acting sugars on hand.
Know how to recognize the signs.
Yeah, absolutely. So, all right. Well, I think that's it for us today. So important stuff to remember. I think clinically, the diabetes is probably the most important because it is life-threatening for our patients. Obviously, there's a lot to remember on which gland produces which hormones and then what's the action of the body. And then probably the next most important thing is Tony Robbins having acromegaly. I think that's probably the next thing.
Yeah. Yeah.
So,
that'll be on the exam.
Yeah, right. Yeah. All right. That's it for us. You have a wonderful day, Christine.
You too. Bye,
Bye.
everyone.
Bye.
That wasn't so bad.